today that on NPR, they're like, why do you want to go kill your parent who's vaccinated? Like, we're back to killing our parents, even after they're vaccinated. What happened?
Yeah. So, I mean, let's start this thing.
Yes.
And then I want to I already like your energy already. So my whole thing is mental health. I mean, I know way too much about you. You probably think I'm stalking you. But like my whole shtick is mental health, and mental health. This is a parallel pandemic, and until you put in the very real components of this organ, we're really not delivering meaningful healthcare. And the messaging needs to recognize the essential needs of human beings.
It's so strange that it hasn't, because HIV, I think it changed really quickly. Like, remember how much we hated people who said abstinence only? Remember how much we called them, we didn't like them?
Yeah.
And now everyone's saying that, like this stay at home message, those 3 words, I cannot stand.
Right. It's like
that
saying,
is such a dumb message.
I mean, do you have kids?
Yes.
Yeah.
They are
and so
11 and 13. Yes.
Yeah. I've got 3, 19, 17, 15. And to tell my oldest, who's like a 5-alarm extrovert, you're not having sex till you're married, and you can't have a beer till you're 21. I mean, he would just
it's so cruel. But the thing is, we modified our messaging for other things. So there's something going on here. Yeah, there is something where I think everyone's internal fear and their own internal biases is informing their messages. You will notice that older individuals who are giving out the messages are their own fears coming into the equation.
Do you think that's what it is?
I mean, to put it very bluntly, I think a lot of old white men are informing our response to this pandemic.
I'd love to talk more about
just that. Just like we started, we figured out really quickly in HIV again, like the community being involved. Like, you're going to prep message to Latino MSM, then have a Latinx community involved. If you want to message to this community, have our community involved. We didn't have the community involved at all. Like, whenever you see those people standing up and saying, you must stay at home and you never must travel, you see that there's not the community involved, like people who are representing different sectors of society who have to work, who are lonely, so yes, I mean, that's the most blunt way to put it, is I think a lot of people get to make decisions on this pandemic based on personal biases.
I mean, we see that in so many aspects of our life. And I mean, bias is like a buzzword, right? Because of all the ongoing racial injustice we're seeing. But I think we bring bias to everything, including the messaging around the pandemic.
Yeah. That phrase "stay at home" really bugs me. I'm sorry, I have to say that again.
So
anyone who's working, anyone who's lonely, anyone who's single, anyone who's a widow, it's just cruel.
I really love hearing you say, and why? I mean, you do have a bit of a megaphone with Twitter, and I'm crediting you for my Twitter addiction. I mean,
I just started in April.
Me too.
Yeah, it's.
No, actually, I didn't really start
time sync though.
I didn't really start Twitter. I started a newsletter in April, but I just got addicted to Twitter, and it's because of people like you and Julia Marcus and Ashish Jha, and I mean, there's so many wonderful minds there, although it is a rabbit hole that all of a sudden you can fall down pretty easily.
But you're giving this element of harm reduction, in what you're thinking about, and harm reduction is the harm reduction takes human needs and behavior in public health messaging. So, my example that I keep on thinking is of the closing down the water pump in the middle of London in 1854 by John Snow. When he closed down the water pump, he didn't say that you're not supposed to drink water. And in fact, he made sure that people had water. So you don't close down everything without making sure that people have financial reparations, or that you're not responding to the needs of people for water. And so I find the very blunt, no, be alone, you just have to stay at home for 12 months, don't date, no Valentine's Day dates, all that, all this stuff around every holiday, don't see your family. I have found it very blunt.
I really, really, really appreciate it. And that is why I reached out to you, and why I was like, I gotta give this woman, I gotta get my hands on her and talk to her, because as you know, one of the reasons people are struggling so much in the pandemic is because all of the mixed messaging.
Yeah.
And, as I was saying to you before we went live here, I think of this as a parallel pandemic of loneliness, isolation, anxiety, stress, vulnerability. And what makes us feel most vulnerable is when we're hearing from experts
Yeah.
so much messaging, and we're watching science play out in like the most, in like high definition television. We don't necessarily need the front page of every
Minute by minute
minute.
updates on if
I mean,
it
science
sits
is,
on copper or
yeah,
cloth or how long it survives on copper, like every minute to minute
we
update.
don't need to know
Yeah.
all that. I mean,
No, we don't.
somebody needs to know that, but
Yeah.
the general public doesn't need to know that. So what
Yeah.
I've been trying to do, and like what you're trying to do, is distill down really complicated information and deliver it to people so they can make sense of all the information coming at them, to understand that the human decision making process is complicated, and that you're not a bad person if you go on a date and you're alone and you're single. Like, we have to understand that people have very real needs.
That is exactly what it is that there's this kind of, because of Trump, we got into this idea that like if you have needs or express loneliness, you could be a COVID denier. And it actually has nothing to do with denying COVID. It is truly human behavior, and needs aren't just ever about one pathogen, whether that pathogen is respiratory or sexually transmitted or GI. It's never about one thing. And if you message, like we had this Valentine's Day, like San Francisco Chronicle just put out a Valentine's Day. What should you do for Valentine's Day? And they always interview one person who's different, who's me. So like basically SFDPH said Zoom or masturbate. And then Dr. Monica Gandhi said, yeah, so you should definitely go out to dinner. You can mask distance and ventilate. And if you want to have sex, then test beforehand. Like it was a totally different message. And it was like, who is this is not like the other. And we need more.
I mean, I just like, I'm so glad that you're out there and that you do have the megaphone that you have. And I loved your recent article, which I just sent out to all of my newsletter readers, about,
Vaccine optimism.
vaccine optimism.
Yeah.
And by the way, I remind my readers of this too. Like, you can be optimistic and worried and nervous at the same time.
Yeah.
Like, you can be optimistic. Like, it's not like I'm, you know, farting rainbows part. I'm paying attention to the very grim realities every single day.
Yes.
But when optimism is there, why not dispense it? Why not explain to people, here is something to hope for in the future that is real and based in science, to get you out of bed in the morning?
Yes, it is. This has sucked. This has been so hard for so many people. And November 9th, when we got the first press release from Pfizer, and then literally a week later from Moderna, life changed. It totally changed. These are extremely effective. And so then everything that you say is in the context of, we will get out of it. Variant schmariants, we will get out of it. And so I'm amazed that we keep on reporting on every little thing.
No, I
Or the
think it's
media
right.
does.
I think at the end of the day, I'm not a journalist, but let's face it, negative news sells. Hitting that, sort of panic, cortisol, adrenaline access in a reader is very gripping. And
I
there's a
didn't
lot of
realize
bad
that
news to
until,
report.
lately. Yeah, I didn't realize that like addiction can be addiction to fear.
For sure.
Like it's this fear-based, it's very addictive.
I think that's so relevant right now, because people are addicted to fear, and then I think there's going to be I think I'm seeing this already. Like, my husband was asking me, he's like, maybe it's like Stockholm syndrome, where people are so conditioned right now to be in a state of constant fear and vulnerability that it's almost harder to let go of, even if there is hope. Like, some of my patients, I'm finding, don't even, these are smart, educated people, are not willing to let go of that fear, even though they've had the vaccine and they've had, they've stepped outside their house and not gotten sick. And it's almost like it's more comfortable to be uncomfortable and do nothing. But we need to realize that it's okay. Once you've been vaccinated, as you have said, 2 vaccinated people can unmask.
Yes, they could
Risk
be
of getting sick is
zero. I mean, when we say like 95% effective, that, I mean, and 100% effective against severe disease, then that means your risk of getting really sick is zero. So I mean, I think if we, you study this more with the mental health aspects, but any lonely older person who's vaccinated, I am positive that in a risk versus benefit analysis, not saying your children and all that loneliness and all your grandchildren, when there's like the 0.0000% chance that like it didn't work for you, but it worked for so many people. I mean, you have to balance the risk of this profound loneliness. You've seen all these studies with the people in long-term care facilities facilitating their dementia and other conditions because they've been so alone. This is the time to message to them, you don't have to be alone anymore.
Right. Right. And before the pandemic, we were already dealing with diseases of despair like crazy: depression, anxiety, loneliness, opiate addiction. And this has only exacerbated those diseases of despair and brought people who weren't in despair into despair. And so
Yeah.
we have to give people a glimmer of hope when it's founded in reality.
Yes.
Monica, I never even really introduced you as we went live on this little thing, but let me just tell the audience here that Monica Gandhi is a superpower here. She is a public health, global health expert, infectious diseases specialist. She and I went to medical school. We miss each other by 1 year. And she also is the director, tell me if I'm right, at the UCSF Center for AIDS Research and the medical director of the HIV clinic at San Francisco General Hospital.
Yes. Ward
And so,
86.
what's that?
Ward 86 is the name of it. We
Ward
love it.
86.
Yes.
Yeah.
Yes.
And so I'm really interested to hear you talk about the lessons you learned in your research on HIV and public health messaging, like we were talking about a minute ago. And like the messaging around like don't have sex, what's also really interesting when that's not realistic, the campaigns and public health and PR around like post-exposure prophylaxis for men.
Yeah.
When we developed the medication that people could take before sex to prevent developing HIV,
Yes.
like what did that do, and do you see any parallels here with COVID-19? Obviously, we don't have a post-exposure prophylaxis. We don't have a medicine you can take after you've been at a nightclub inhaling someone's COVID breath.
Yes.
But like there are parallels here. Like I guess the ultimate question is, why are we doing such a poor job of messaging to the public that we're going to get through this? The vaccines are miracles and we are going to be okay.
I wonder if some of the people who are talking are also addicted to their own sort of, I mean, I kind of think of like a lot of infectious disease and public health people as they didn't get to talk very much, and now they get to talk on TV.
Oh my God, I
and I
love
know that's
hearing
not
you
very
say that.
nice of me to say, but they didn't get dates in high school, and now they get called all the time.
Oh my God, I love you. Like, oh my God, I love hearing you say that, because I think you're right. I think it's like people who are stuck in labs and like pipetting for years and like writing research grants, and like now they get CNN and like Anderson Cooper.
And Anderson Cooper looks so nice, and he's like, like he's all, you want to be around Anderson Cooper. So it could be that, because endless discussion, for example, of mutations is something that you do in an academic setting, like with your colleagues, but it does not belong on TV, in my opinion. And this endless discussion of, oh, I don't think it's going to work anymore, or I used to think we were going to be okay, but now we're not going to be okay, it's just not grounded in reality. And so I'm wondering if maybe CNN and MSNBC, I think they should expand a little bit. I will just say that out loud. But I also think that, we've gotten used to like nothing going right because it's been so hard. 2020 was so hard. And then what happened in HIV is like, you could actually avoid risk even without condoms. You could talk about things like what positive and positive people should do together, what positive and negative people should do together with HIV. There were ways to nuance your messaging all along, even before we got to PrEP, even before we got to U equals U, which is undetectable equals untransmittable. Now we have injectables for PrEP that are going to come out. We had so many tools along the way, but every time we refine the messaging to take into account that it's a human need to have sex, or that was what people wanted to do. And so here we knew about masks, distancing, and ventilation pretty early. And we could have actually messaged like a plane, this is what you do, and this is what you do in a school, and this is what you do in a business, and we keep it like 20% down. But we didn't. We did not change our messaging. We're stuck back in March. Some people are stuck back in March. Still wash surfaces, wash everything, stay away from people. That's the safest way instead of mass distancing, ventilation. So yeah, I don't know. It's the same people saying it though. So maybe they need some more variety.
Yeah, and let's talk about the school phenomenon for a second, if we could, because it's top of mind. I mean, as you know, you have kids, I've got teenagers, I've got one who is in college, and college, his first semester of college was basically like a police state, and to the benefit of the public health and in the state where he goes to college, but at the expense of his mental health.
Yeah,
Um, and we're all desperate for our kids to go back to school. I mean, not only is school important for kids' emotional health, it's important for our economy, it's important for women, it's important
working
for
parents.
working
Yes,
parents.
exactly.
So it's an essential function. And so I don't understand. I mean, I can try to understand, but I don't, at the end of the day, fully understand public health messengers saying that it's just not safe to go back to school until all teachers are vaccinated. Now, I'm sure that there's some teachers listening who are going to want to murder me. And my saying that schools should be open when safe is not disrespecting teachers. Obviously,
Not at all.
as a physician, my job, your job, is to help people from death, disease, and suffering. But I
Right.
think there is a way to do it safely, and the studies bear that out. Now,
So well.
let's also acknowledge though that data is one thing, but every school system is different, right? Like there's a school that can maybe do it perfectly, all the risk mitigation. There's a school that has terrible ventilation and overcrowding and they flout the rules. And so but if you give schools the resources to manage risk, then it is possible. And then we have a win-win where, teachers are safe and kids are being educated and the economy is back and running and mothers and fathers can go back to work.
Exactly. I mean, the CDC director, Rochelle Walensky, who we now know well, she
Yes,
did say last week that, vaccination is not a requirement because of the really excellent North Carolina and Wisconsin data that came out of this country just in January of these really safe school openings. And by the way, ventilation doesn't have to be too fancy because even cracking a window is good, and you could make your mask stronger if your distancing is less, if you're more overcrowded. So there are ways to compensate for it. I don't know what happened, but I think it will go down as the greatest failure of the US response is failure to open schools in many states. I think it will go down in history as something we did wrong. And it is maybe this fear-based messaging that we should have unhooked from when we knew more about the transmission and how to keep people safe, and we didn't unhook enough. And then we got to vaccination, and then we started arguing about, oh my gosh, do vaccines reduce transmission? And then suddenly we opened a whole other can of worms that you may not be airtight, which was just silly. And so it is very sad because I can't believe that parents and teachers are now at odds when they used
I
to be
know.
co-raising children.
I
It just
know.
breaks my heart.
Right. Teachers are, to me, like the glue of society.
Yes.
And
And we
and
used
you're
to be
right, they
so
do
close.
co-parent. Like
Yeah.
I credit my kids' teachers for the reason they have any sort of shred of like mental health because
Yeah.
it takes it takes a village. And so
They
I
are
have the
excellent.
utmost
Yes.
respect for teachers. The last thing we need is for teachers to suffer unnecessarily. But there are ways to do it safely, and it's a very complicated dilemma. It's what's interesting to me is if you look at like every year with the flu.
Yeah.
I mean, and we lose what somewhere between 40 and 60,000 Americans every year to
Yes.
influenza,
Right. 40,000. Yeah.
and adults, kids all get sick from flu during not all kids, but
Kids
but
more get sick than that. Yeah. From flu than COVID.
right.
Right.
And yet we don't close schools during the flu season. I guess the question is, and this is just sort of like an ethical, moral, philosophical, unanswerable question, is like, what's our threshold? Like what kind of risk tolerance do we have in
You know
place?
what I have been thinking about recently is that I wish we had never imposed testing in schools as a prerequisite. Why? because universal precautions means just that. You actually assume everyone has COVID. And so why would we even be masking around each other? It's not like I know we're both negative and we just tested yesterday. I mean, if you just tested, by the way, that day, you really could take off your mask. But anyway, so that is universal precaution. So that's what you have gone to work every day from 8 to 5, seeing patients since the beginning. You've never taken a day, and you can see that you didn't get mass tested like twice a week because
That's
it
right.
was you. But what you did is you assumed your patient had COVID, so you did mass distancing and had the window open a little bit, and even when it was cold, and so that's what you did. And so by the testing and then quarantining, and then people getting confused how frequently we should test, since we're not Saturday Night Live, I keep on thinking of that. Saturday Night Live, they have to be sitting on each other's laps and stuff without masks because it's funnier.
Oh my God, I like that
But
reference. Like that's, yeah.
but we're not, but that a school isn't Saturday Night Live. So, and neither is a healthcare and a grocery store. So we are not that funny. So I think the testing and quarantining, that was a great thing about the North Carolina studies. They didn't do a lot of testing or contact tracing, and still there was incredible safety for the teachers.
Yeah. Yeah. I mean, it's just, at the end of the day, it's how do we make decisions in our daily lives pre-pandemic and now? It's about knowing the facts, which, aren't, in my opinion, up to interpretation. And I'm sure you would agree. Facts are
Yeah,
facts.
yeah,
Weighing the risks, weighing the rewards, and then making a decision and then living
yes,
with it. And everything we do carries risk. Um,
yes.
it's
That is
like,
the weird thing, is we all,
yeah.
it always has, but we.
Well, like my son, it was snowing here in DC last week. My son wanted the car to go to his part-time job. And it's like I'm weighing the risk and the reward. He could trudge through
Yeah,
the snow, or I could worry that the visibility is not good and there's ice on the windshield. And we mitigated the risk. I did my like anxious mom hand wringing thing, which doesn't help. And then he went and said he drove slower and like, but if my only goal was for him to never get in a car accident and God forbid die, I wouldn't let him leave the house.
exactly, exactly. I am knocking on wood about that, but yes,
Yeah, I
exactly. So
shouldn't say that out loud. And I
if
know
you
that's,
had said abstain from all activities your entire life, we all watched that Boy in the Bubble after school special because we're like around the same age. Remember how awful that was? That was awful.
yes,
He was really lonely.
he was really
So
bummed. And
that's,
there was
yeah,
no
but
like
that's no
Xbox or
risk. That's no risk. Yeah, life.
that's no risk.
Yeah,
Now it can be an unpopular argument to make because people, if they don't trust me, if they don't trust you, and they see the headlines and they are hearing from their friends the fear, the vulnerability, they will say, well, how dare you liken your kid driving in the snow to me dying from COVID-19? And to that, not that I don't know if anyone's saying that right now, but like I just think that, you know, because people have been making these analogies like driving on the highway and I wear a seatbelt. We
yeah,
are in an unprecedented situation. I mean, we're going to get to 500,000 deaths in the US,
yeah,
this
yes.
month. And so it is unprecedented, but it's not that we don't know what's happening. We know the
That is
facts. We
exactly the
have
point.
we none of
Yeah.
this is like that mysterious. I mean, not to say that I like know everything, but it's not mysterious. Viruses mutate. We've got a handle on it. It's just
Yeah, that's
humans are,
exactly,
yes.
yeah. I mean, that's exactly the point, that like all of this was merited in March before we knew about surface transmission. Okay, not a big deal. There's no really surface transmission, none actually. Masking, distance, we didn't know about masking. Now we know about masking, distancing,
Yeah.
ventilation. So now we know. So why wouldn't you put all of those things into your pot about making decisions as opposed to like totally acting the same way as in March? That belies all the scientific information that has been published since then. And it changes a lot, but we pretty much have a handle. It's not radioactive. I haven't seen that movie. I have to see it, but it's not like that movie Contagion. Whatever, if there's any radioactive virus, this is not this, and no virus is radioactive.
Right. I mean, it's incredibly
Respiratory
wimpy.
was
It's
correct.
incredibly wimpy against open water, right?
Yeah, yeah,
The vaccines are amazing. Let's just
amazing.
talk about the vaccines for a minute. So if you had said in July that we were going to have even a 50% effective vaccine, we would have been like ripping our clothes off, running down the streets, jumping for joy.
Yes,
We
we
now
get
have
95.
we now
Yeah,
have two vaccines currently, we're going to get more, that are 95% effective against COVID-19. So and then 100% effective against severe disease and death. I
A
think it's important to
hundred
define what
percent.
that. I think it's important to define what that means. No
Yeah,
one who got the vaccine who was exposed to COVID-19 got that sick or
hospitalized.
died or hospitalized or
Yeah,
died.
I mean, you could divide hospitalized death into one column, so no one died, period, who got the vaccine, and a
Right.
few people died who got placebo from COVID. No one died in either from any vaccine side effects. They were very safe. Then severe disease got defined differently in all of them, and they always included this subset of individuals who were hospitalized or died. But every severe outcome was in the placebo. There was one person in one trial before they got immunity that did end up getting hospitalized in Moderna. But in general, anyone who had a severe outcome where they needed oxygen or they just didn't feel well at home, well enough, they just needed more attention at home, but they were still at home. All of those were in the people who got placebo, no
People who
vaccine.
did not get who got like the sugar version of like the nothing.
Exactly, the nothing, the water.
Yeah.
They were saline. Yes,
And so,
exactly.
as you have said, and I just love this verb, I don't know if you coined it, but the vaccines have defanged
Yes.
the virus. It's important to understand what that means, that a virus that has no fangs is just a virus. Like
It's nothing that we should pay attention to.
you and I have had
Yeah.
coronavirus, not
Yeah. So
the
many
novel
times.
coronavirus, like
Yes. Yes.
hundreds of times or lots
Yes.
of times. We've had rhinovirus, we've had adenovirus, like, remember the days when you go to school to work with like a cold.
Yes.
So if you defang a virus, it's just a virus.
It's
And our
just a
standard
virus.
should not be getting rid of it entirely. And it frankly can't be at this point. Like it's going to be with us for a long time.
It is,
We just
but
have to defang it and
as
turn it
long
into
as
a cold.
it's, yeah, like a little thing, like a thing that runs around and causes a cold, we would never have even noticed it on 12/31/2019. If like Wuhan contacted the WHO and said we have a new cold, they'd
We
say,
have a new
great,
cold.
tell me next year, I'm really busy.
Right.
So it was serious. It was very scary and serious and terrible and could cause severe disease. And now you take away all of those, then you have a virus that can make you not feel great sometimes, and have a cold and stay at home.
And I
So
think part of the
it's very
messaging,
important.
if
Yeah.
is the messaging that you're emphasizing in all of your writing is that we can't compare the benefits of these vaccines, if anybody wants to criticize them, which to me is crazy, to a world without any benign viruses. Like
Yeah.
we live in a world with viruses.
Yeah.
If they have fangs and claws, like
Yes.
COVID-19
Right. Oh my
or
gosh.
the
Yes.
novel coronavirus, you
Yes.
defang, you declaw. That's what the
Yes.
vaccines have done,
Yes.
including the new variants. We have
Yes.
defanged and declawed,
Including the new variants.
including the variants. The variants, I love what you just said, variants, schmariants. I mean, that should be
I'm
like
sorry, but it's
that should be the CNN banner tomorrow. Variants, schmariants.
They'll never have me on. They'll never have
No,
me
but
on.
see, like
I'm very
we need
cheerful.
like
I'm
a
too
parallel
cheerful.
channel here, and we're just to be clear, we're not saying COVID schmovid. Like, no, this is
Yeah. Right.
a
Right.
worldwide
It was
global disaster.
terrible. Yeah.
But the variants, as you said, should not be on television.
Yeah.
People needn't see like the play-by-play
Yeah.
of
Oh
science
God.
playing out,
Yes.
and
There's so many mutations in HIV, and I cannot believe that public know that, like now know it for SARS-CoV-2, because we talk about mutations in HIV
right,
all the
and
time,
people are
but
following
only the
administration.
geeks do. That we should not be talking about them out loud.
And I also love what you said, just as a side note, about why all these people are so popular is because they were the geeks in high school, and now they're like getting on, Anderson Cooper. But
Maybe
anyway,
with makeup.
yeah. But the point is that efficacy of the vaccines is defined as not dying, not getting hospitalized, and if you're in the 5% of people who has Moderna or the Pfizer vaccines, both doses, you wait 2 weeks, and you are in the 5% that happens to get infected, you're going to have basically a cold.
A cold.
A
And
cold.
that's exactly right. And thus I cannot keep my parents home for a cold. And
No.
so when they're vaccinated, they will come. They will come to San Francisco. They will go to Boston. They will see all their children. They're 80 and 86. They're really lonely, and they will fly all over the country immediately.
Yeah.
So 2 weeks after the second vaccine. So you're right. You cannot do that for a cold.
So a patient called me today and said she's on the fence about getting the vaccine. She's a very smart person. She has a PhD in economics, and she said, "Why should I get the vaccine when the variants are here and obvious or evading protection from the
Oh
virus.
no,
And I
she's
said,
listening to the
yeah,
wrong
I know.
channel.
And I said, I mean, I couldn't call her fast enough. This is like the kind of question I love. I'm like, you know, I said, look, first of all, the data is the data. The data shows that the Pfizer Moderna vaccines are still very effective against the variants. The recent news, today's headline and yesterday's headline, was about the AstraZeneca
Yes,
vaccine. It's making people crazy.
yes,
They halted the trial in South
big
Africa
mistake. Yeah,
because the AstraZeneca trial recipients were not being protected against mild to moderate disease, which is like having a cold. But they
right.
halted it, so we're not going to ever know whether it prevented death and
We're
destruction.
not going to know. I mean, the few outcomes we do have, again, all the severe disease in all over the place. We're in the placebo, the water pill, the water
Yeah,
shot. So we do have some data that it prevents severe disease, but we could have gotten more.
and the J&J shot,
Yes,
we also know, which also isn't as effective against the South African variant, but still is fantastic against the South African variant.
exactly.
Is 100% effective against death and severe disease.
Hospitalizations.
So we
And
can,
then the
yeah,
same level of efficacy against even the severe disease that you manage at home. So if you
right.
don't like feel great at home and they've called that severe, but you didn't even get hospitalized, it's the same with the South Africa variant, and 95% of the viruses were the South Africa variant in South Africa. They actually sequenced them. So we
Yes,
know it works.
right. So someone's asking here, okay, so after vaccination, do we not wear a mask? So this is a great question. That's the answer is that's not what we're saying. It depends. And this is what we're
Depends.
talking about. So what we're talking about here is about nuanced, tiered messaging.
Right.
So it's not
All the time we do this.
we don't need to tell everybody stay home, never leave your house. After you've been vaccinated, you can't be free. And we also don't need to say, hey, once you've been vaccinated, go out and start kissing strangers in the pub.
Yeah.
There's tiered messaging here. So the answer
Yes.
to the question about should you unmask when you've had the vaccine is it depends. If you are with another vaccinated person in the privacy of your home, like if you and your husband, like my parents are about to get their second dose, once
Yeah.
they have both been vaccinated and have waited 2 weeks, there's no way they are infecting each other. So they can unmask.
Exactly. Have your
And
dinner party with your vaccinated friends.
have your dinner party with your vaccinated friends.
Yeah.
Vaccinated people all together, fine, no matter how many people they are.
Yes. Yes. We should think about it in the healthcare industry, but yes.
Yeah.
For
However,
in-person meetings.
in public, my parents, when they've been vaccinated, or when I've been vaccinated, when I go to the supermarket up the street, I wear my mask.
Yes.
Because there's still not 100% proof, and we don't have it yet, that I can't transmit the virus. There's also the small chance I could get COVID-19. I could get a cold, but also just out of respect for everyone in the grocery store,
Exactly.
I'm not going
Exactly.
to unmask because no one knows that I've been vaccinated. No one knows that,
Exactly.
and
Exactly.
and we don't have the data to show that I can't transmit virus.
We're getting more and more of that data,
Yeah.
but at this point, it's the most respectful thing to do is to message that way. Like vaccinated, everyone masks out in public because it is the right thing to do to help our unvaccinated friends, just in case we have a little bit in our nose. And then we'll ultimately get to a point where we don't need them. That's right.
Yeah, I mean, the data so far is what we would have expected, that it's probably going to turn out that people who've been vaccinated also are protected against transmitting.
Right.
So that data you were tweeting about today from Israel is really hopeful.
Really hopeful. Yeah, the real world rollout, and also even some of the trials.
Yeah.
And also just biology probably means that.
Yeah, it makes sense. It also makes sense that if you've been vaccinated, if you carry virus, it's going to be not enough of a viral load to infect another person.
That's right.
But we need to prove that out. And until then, vaccinated people like myself or you wear a mask in public when you're around other non-vaccinated people.
Absolutely.
So but at the same time, we do need to have that science play out. We need to see that that's true. But I would be shocked, wouldn't you, if we turned out
I would be shocked, and it's already playing out like with data after data. And it is, this is the other thing, is that once there are no, like, in India, for example, right now in major urban centers, there's like 2 people in a hospital with COVID. When you get to that stage, you cannot, and that's complicated, but it's more likely because they have been rolling out vaccine, but it's also they had COVID that went undetected in younger, healthy people. with natural immunity. When no one's in the hospital, there will be a natural falling away of these restrictions, and a natural falling away of fear. I'm sure there are some people who are very fearful of the word case, but most people were very fearful of the word hospitalization. And so
Yeah.
that natural falling away, people think they were going to keep restrictions forever. They're just not. They're
Yep.
not.
Well, I mean, look at the Super Bowl yesterday. Obviously, some people have no fear even now.
Yeah.
I mean,
Actually, I think 7,500 healthcare workers were there they were invited to it because they'd been vaccinated.
I thought that was kind of ironic. You're like, it's like, let me reward you by showing you how insane people are. But anyway, it was just,
I didn't. I'm so mad at football because it hurts people's heads that I didn't even
yeah,
see
I don't know.
the
I mean,
traumatic brain injuries. I have to be against it. I'm sorry.
I know I watch it for the commercials, but this is a really good question someone's asking. What about the concern? And this, I think it's an excellent question. And actually, do you know Dan Griffin, who does
Yeah.
TWIV, was
Yeah.
answering this question recently? So what about concerns that you have just a cold? Like, what, you're in that 5% of people who you got vaccinated, but you got COVID and you only have a cold.
Yeah.
What about the chance of that person becoming a long hauler? Because we know that it's not just people in ICUs from COVID that end up having long-term symptoms. It can be people who have mild to moderate disease. I mean, I think, you're probably gonna have a lower viral load when you've been
Yes.
vaccinated, and therefore,
Yes.
in my opinion, probably a less likely chance of having long COVID. But what's your thought?
Yes, there's a cohort study that I'm waiting for them to publish out of UCSF called the Link study, where they're going to show us that severe, more than moderate, more than mild causes more longer term symptoms, which totally makes sense because when you have severe COVID is when you have the the non-specific innate inflammatory response that can give you this longer term inflammation. There are many, many people who that we estimate like 30 million Americans have had COVID, and so many didn't know they had it, the asymptomatic, and they are not besought with such symptoms. So I do think that it is going to be linked to severity of disease. So getting it all down to asymptomatic or mild is going to help not have these long symptoms. And people don't come to medical attention because they didn't know they had COVID. So I'll wait for that data to be able to tweet that and show people that good
Yeah,
data that
but I think what you're
associated with
saying
severity.
is that it stands to reason that if you've
Yeah.
been vaccinated, even if you get COVID,
Yes.
which is a
That you're not going to get
very tiny chance,
very teeny,
that you probably would not get long COVID because of
because you
the,
had very mild symptoms and you may not have even known it. Yeah.
yeah, and I love,
And you don't have that inflammatory response because your viral load is so low.
yeah,
Yeah. You
yep,
can't pass it because your viral load's low, and you also shouldn't have a big inflammatory response. That is clearly linked to anything long is an inflammatory response.
yep. Someone's asking, can you transmit COVID if you have antibodies? Well, let's talk about, you get antibodies in, well, I guess 3 ways. One, you have COVID itself, so you get the
Yeah.
disease and your body generates antibodies. 2, you get antibodies if you get the vaccine.
Yes.
It's a vaccine that mimics the spike protein of the virus. Your body makes antibodies against the spike protein and you've got antibodies and you're protected.
Yes.
3 is if you get COVID and then you get the monoclonal antibodies, the infusion of that medicine, one-time dose where they give you clones of somebody else's antibodies who's recovered from COVID. So can you transmit? And that's what we were just talking about a minute ago. The answer is we don't know yet, but it stands to reason that you can't. It stands to reason, like all the data is not in, but so far the data shows us that probably not.
What I thought was really helpful is to look back at old systemic vaccine papers and
Yeah,
see that they stimulate IgA, which is that particular, as you know, antibody that goes into the nose. It's just that none of these trials actually looked at their appendices, measured IgA, but I'm sure it did stimulate IgA. And then also to see that there's plenty of IgG, which they did measure. That's the particular immunoglobulin in your blood that goes into your nose and mouth, mucosal surfaces. So I think it just completely stands to reason that these antibodies they're going to be able to be at the place where you could transmit.
yep. So probably like they do to you, people ask me all the time, like, okay, what's your prediction? Like, when is this going to be over? When are we going to have herd immunity such that people can really live their lives unmasked and we're going to be back to, normal? I mean, first of all, I think we'll have a very different normal just like post 9/11, everything, the world changed.
Like
Um,
PTSD, yeah.
yeah,
I
well,
mean,
there's
yeah.
PTSD, and then there's also just the, like, I don't know if we'll ever handshake again. I don't know. Do you think we will?
Yes, oh, that's the other thing is I think that this primate stuff that we have going on, this like, this like where they're always touching and we're just touchy
We're touchy
primates.
people. We're touchy
Yeah, like it's
animals.
just who we are. Like, you know how like you keep on seeing people and like your whole body wants to hug them or like,
Yes.
or you just so want to do this. This will come back. I'm sorry. Like we are just so primatey. So I'm not worried about that.
Hi, matey.
But
I
but
love
I
it.
do but I do think that I used to think summer, then the vaccines were slower than I thought. 32 million people now have been vaccinated in the US, so a tenth of the US population. Then I thought fall, and I only think it's going to be fall if we get Johnson & Johnson on February 26th, because that's when the EUA is being reviewed by the FDA, and I really want it to be approved. And then I would say fall. If not, the way the Moderna and Pfizer is going, I'm going to give it winter of 2021. And I mean normal. You may not want to shake someone's hand or hug because you're nervous, but with time that will fall away. When you see no hospitalizations from something scary, you will, like, that natural impulse will be there.
And I think, would you also say that between now and then, there's going to be a lessening of the oppression
Yes.
of the pandemic, right?
It's just natural.
It's gonna, like, pandemics end,
Yeah.
tragedies end, obviously with a lot of damage and wreckage in
Yes.
the meantime.
Yes.
But like, if I had to predict, I would say it looks like the supply of vaccine, particularly if J&J gets approved, I think this week, or next week,
Not yet.
that like by April, May, we are probably going to have a big influx of supply.
Yes.
And
And
so it's
then just
basically,
like the Israel rollout, we're going to see lower and
oh,
lower
yeah.
hospitalizations and cases. Yeah.
Yeah, and so it's a race, right? It's a race between the
Yes.
virus's ability to mutate, which it's doing.
Yes.
We expect it to. That's what viruses do. It's doing its thing. And our ability as human beings to get the vaccine into people's arms. And it
Yes.
feels like, given the data on the vaccine's ability to be effective against even the new variants,
Yeah.
and the supply that's coming, and the Biden administration's, you know,
Signing of the National
bashing
Defense Act and all this that
that
they're doing.
that
Yeah.
it's going to converge, it feels like, in April and May,
Yes.
when the virus is just starting to, like, outsmart the vaccines, and we're getting a whole bunch of vaccine, and then we're going to be okay. That's
Yeah.
my
I think I mean, maybe fall is too long. Maybe it's going to be summer. I like your prediction. And I think that all eyes are on increasing vaccines right now. All
yeah,
eyes are on it. No one's talking. They
yeah.
are talking about the variants too much, but otherwise most people are just talking about let's get vaccine rollout. So you're right. I think it's going to be sooner.
Well, I don't think that, I mean, I think that there's going to be a lot more doses, but remember, like, people have to get them separated by a month, and they have to wait 2 weeks, and then there's going to
Not if we
be,
get Johnson & Johnson, but yeah, I'm
oh,
hopeful
that's right.
about
If
that one.
J&J is
I'm
only
very
one
hopeful
dose.
about that one. Yeah.
I think so. A couple of people are asking here. We forgot to talk about this. We talked about vaccinated people getting together with vaccinated people. Fine, get
Yes.
together, husband and wife,
Yes.
couples. If you're all vaccinated, you can't get sick. Do it.
Yes.
Enjoy your life. What about vaccinated people with unvaccinated people, like grandparents and their unvaccinated teenage kids?
Yes. So I think you have three choices. One is that you think that the transmission is so low and that especially with teenage kids that their risk of getting it is so low or their severity of disease would be so low that you don't mask and distance. Second would be mask and distance. And third would be test if you're going to visit them. So you could go and test, like if like for example, my parents are coming to see three vaccinated adult children, but they all have children and no one's concerned about the children around them because this teeny bit of virus that could be in their nose, which I don't think will be, I'm not worried about younger children. But you could, if you want to go see someone who's more vulnerable, like the older parent going to see their child who's not vaccinated, who's more vulnerable, I would test before I went crazy with not social distancing or hugging. Or you can mask and distance for the first few days.
Yeah,
And
that's
then you,
great.
just like you do when people say go and visit, you do wait that first 5 days.
Yeah, it's basically what you just did was it's tiered messaging.
Yeah, yeah. It's not that hard. Yeah,
Weighing the benefits of togetherness and
yeah,
convening with loved ones against the very infinitesimally small risk of the vaccinated person getting sick, and then the risk of someone who's young and healthy getting sick enough that it even is a thing.
Yeah, exactly. So everyone, and the public has enough information at this point that they will actually make a decision for themselves. That's the other thing about not infantilizing people. I don't think we needed to do the copper study, that it doesn't last very high in copper, but there is a lot of studies that have been put out, and a lot of people know a lot about this virus, and everyone will make their adjudicated decisions about what they're going to do. And so saying no never helps when people know enough, just like they knew about sexual safety.
Yeah, like as we were talking about before we went live here, and then I'll let you go, is that like telling your teenage kids, like, you know, I have a college student, like, you know, don't have sex till you're married and don't have a beer until you're 21. I mean, a lot of parents do that, and like, and there's style variances between parents, and there's risks. Like if you have a history of alcoholism, like that's gonna be a different conversation with your child than if you don't, right? So, and this is where nuanced messaging matters. But at least in our house, we try to factor in the realities of what we're dealing with our kids, and then the dangers, and just like, it's not a perfect analogy, but like just like with COVID, like when you give people information and you empower them with the tools to make smart decisions, I feel, and I think you agree, that then people are more likely to make good decisions, and they're more likely to trust public health experts than if they say, don't have sex, don't leave your house, don't have a beer till you're 21, and like, by the way, you're all,
trust is a two-way street.
And by the way, you're all bad people if you do any of those things.
The shame that will have to be a whole other topic. The shame-based messaging.
Yeah, like you're a bad person. It's like,
totally unhelpful. Yeah.
So yeah, I think I would love to like take you on the road, Monica. Because
thank you so much though, because everything you're saying is coming from a standpoint of someone who literally talks to people all day long.
I talk to people all day long.
Medical, like what they should do medically within the context of their own environment. And that kind of tailored messaging is actually what we do as clinicians. And I'm really confused that clinicians haven't entered the mix more about messaging, because I think
that is what I've been trying to do since March, is this messaging. And that's why I've been doing this, you know, blitz on, not on Twitter. I've only recently been on Twitter, but on just with his newsletter, and just trying to help people. It's just sort of like my public service. Also, I love writing, to help people make sense of all the craziness. And look, I'm a little crazy too. And you don't have to trust me if you don't want to, but I'm also not asking you for your money. I'm just telling you what I see and what I hear and what I know.
You're being completely fact-based as a doctor and scientist. Yeah, but you're not fear-based. You're fact-based.
Not fear-based. When fear is in the driver's seat, we make really irrational decisions. So when people are afraid of the vaccine, then they don't get vaccinated. And then they get sick. And then when we bring in rational thought, and we tell our amygdala to take a chill, then we make smart decisions, and we're actually safer and healthier. And then we don't feel like we're in a state of panic all the time.
Well, thank you for inviting me.
Oh my gosh, Monica, it was so much fun. Thank you very much. And I will continue to retweet your brilliant ideas, and I'll talk to you next time.
Thank you so much. Okay. I really love talking to you. Bye.
It was fun. It was fun. Bye, everybody.